Hey everyone, welcome back to the course. So in the last video, we talked about the privacy rule. We took a pretty deep dive into it so you can fully understand what it's used for. And then in this video, we're going to talk about the security rule. Now again, the differentiating factor, or the main factor that's different between the two, is the security rule is going to cover your electronic PHI, or your electronic protected health information. So definitely remember that, especially if you're taking some kind of HIPAA test through your employer. If you see a question around that on there, again, I'm not giving you answers to a test because there's many different tests out there, but just understand, again, the security rule is for electronic PHI information. Now with that, it's going to outline three different types of safeguards. So we've got administrative safeguards, physical safeguards, and then technical safeguards. So administrative safeguards, what are those? So basically those are going to be things like your written policies and procedures. So things that designate like a privacy officer, and most healthcare companies have this in some capacity. They write out and say, the director of nursing is our privacy officer, or, this person in accounting is a privacy officer. I don't know why you would do that. Or, and more commonly, like somebody in the QA department is the privacy officer, or an attorney is a privacy officer, et cetera, et cetera. It could basically be anybody, but there's somebody that's kind of in a senior level type of position that will be deemed as a privacy officer. And so that would be the case for developing and implementing any required policies and procedures. Now, the procedures themselves have to identify the classes of employees that are going to have access to electronic protected health information and restrict it. So again, restrict it to only those employees who need it to complete their job function. So let's say that I'm the janitor, right? I don't really need any access to PHI to go ahead and empty the trash and clean the rooms. I don't realistically need that, right? Now, you're still going to have me sign like HIPAA stuff and put me through HIPAA training because I may come across that. I may accidentally go in a room and start cleaning it. Well, not accidentally clean it, but I may go in the room and then I accidentally see, because the nurse left a computer screen up of some patient's chart, I might accidentally see some information. So obviously I'm going to have HIPAA training and have to sign some waivers, but I won't necessarily have to be a person that's specified in the policy or in the procedure, because I'm not going to be that class of employee that would have access to that information. Now, I still may be specified. They still may say, hey, the janitorial crew, may inadvertently have access to protected health information, and so we make them sign, a certain waiver or whatever. The procedures that are developed also need to address the access authorization, establishment, modification, or termination of the PHI. And then also what entities have to do is they have to show appropriate ongoing training for the handling of PHI. So anyone that's worked in a hospital, for example, or a doctor's office, that you generally speaking have to do annual HIPAA training. And so you go watch some videos like this course or whatever. You look at some documents, you sign off saying, yes, I know everything about HIPAA now. You take the test, hopefully you pass it. And if you don't pass it, you have to go back through the training usually. But basically the security rule under the administrative safeguards, that's where it actually specifies that you have to develop that as an organization. You have to develop that ongoing training. It also specifies as the administrative safeguard, so the policy is going to have to specify that you've got to back up your data, right? And then also you've got to have disaster recovery procedures in place, so that way if something happens to your data, or if we've got a natural disaster, hopefully you've backed up stuff to the cloud so you can still access that data at some point. We've also got to establish internal audits, so that way, operations can be reviewed. And again, the goal with that, the overarching goal, is just to find out if we got any type of violations of HIPAA, and so we can make those corrections before Health and Human Services finds those violations and charges us a lot of money. And then also, the procedures, so the administrative safeguard procedures should specify instructions for addressing and responding to security breaches. So think of things like your incident response plan. That's where that would be encompassed at, under the administrative safeguards. Now, I've never actually seen a HIPAA test that goes that in depth on it, but maybe for IT personnel it might. Your organization may require that. But basically, if you get that type of question, just your incident response plan would generally fall under the administrative safeguards area. Your physical safeguards. So obviously most people could figure out we want to put a security guard in place as pictured here. We want to put locks on doors, that sort of stuff. So the physical safeguards would cover the physical access to the protected data. So that's, can I go in and just grab your computer and run out, or is it bolted to the wall? Where are your computers at? can I physically access stuff? Can I go into the floor even? Are the doors locked where I need a key card or something to get in, or I have to buzz and somebody has to let me in? What kind of physical safeguards are in place? We also want to control the physical removal of hardware and software from the network, and make it limited to authorized individuals. So I don't want like somebody's, family member able to get down the network and remove software from one of the computers or run out the door with a computer, right? I don't want them to do that. Also, we want to, as part of the physical safeguards, we have to restrict the access to any equipment that contains health information. So we have to also monitor that as well. So most hospitals do this by having access control doors, right? They have cameras everywhere. They have people watching to see, if somebody's running out the door with a computer, right? So we've got things in place in most organizations nowadays to cover this, but that's where the physical safeguards come into place. Also keeping monitors out of public view. So what you'll find is that a lot of times, in the olden days at least, and I can tell this from my own experience way back in the day as a nursing assistant, and I'm not going to tell you when because that will date myself, but a lot of times they would have computers where anybody could walk by and just see what's on that computer. So think of things now like, screen locks or just basically hiding the monitor, so using monitor screens, or just having the monitors all inside of like the nursing station where like the average person can't just walk behind there, because there's usually somebody in there that says, "Hey, get out of here." So I've actually tested that before, and they screamed at me, "Get out of here." They didn't say it like that, but they yelled like, "Hey, you can't be back here," type of thing. So, that's what we're talking about here. We're talking about not letting, Joe Schmo come in there and look at the patient data. We just want to be mindful of where the monitor screen is facing. And then also, under the physical safeguards, make sure they're doing training. So, contractors or any type of, business associate, to make sure that they're following those same things, right? They're not letting some, average person out there just walk by and look at the patient information on the computer screen. They're being mindful of where the monitor is facing and making sure that nobody's like standing behind them and shoulder surfing is what it's called, to see what they're doing on the computer. We then have our technical safeguards. So, as the name implies, this is going to be any type of protection from a data standpoint. So, we want to protect anything, any computer or system that's housing our PHI or transmitting our PHI. We want to protect that from intrusion. We don't want some criminal hacker stealing our data. We also want to set specifications that the data we have can't be changed or erased in an unauthorized manner. So we don't want to just allow somebody to go in and erase all of the data for, Jane Doe's chart. We want to make it, basically against our policy so that way we're in compliance. Now, if it's authorized change, right? So if if it's some kind of authorized change, like, oh, oops, I made a mistake on this or that, or I accidentally opened an extra note in a chart and I didn't mean to set certain stipulations in place of like, why is that an authorized removal of data? We also want to corroborate our data to make sure the integrity is there. So that's what corroboration is all about. So using things like a checksum, double keying, authentication of messaging, digital signatures is probably the more common thing there. And basically, again, we're just doing the data integrity. So that way, if I send you an email, as an example, if I send you an email, the email actually is the original state from me, or if I email you a document or something, that's the original state of the document. So maybe I've protected it with a password, or, I've digitally signed it in some capacity. So that way, it's the real thing that you get on your end. The other thing for technical safeguards is that the entities must actually make your documentation, or you have to make HIPAA practice documentation available for the government. So if HHS comes in and they start looking around, you have to be able to say, like, look, here's how we're complying with HIPAA, here's all our information about it, and here's all the technical safeguards that we have in place. Also, the information technology documentation under our technical safeguards, that should include a written record of all your configuration settings. So your network topology, all this stuff, all that should be documented. Now, of course, you're not just going to leave that out there for somebody else to find, but you need to have that so that way if like HHS or another entity comes in, they can see that you're actually taking the appropriate measures under HIPAA. And then you have to document your risk analysis and risk management programs. You have to document that stuff as well. Again, when we use the SRA tool a little later on in the course, we'll talk about risk assessment. We'll actually go through and do a risk assessment for a sample organization. All right, so in this video, we talked about the security rule. In the next video, we're going to go ahead and start talking about some of the common types of HIPAA breaches, and we're also going to talk about the penalties related to civil, both civil and criminal under HIPAA.